Our topic this afternoon is healthcare reform in an election year as it affects physicians. Dr. Gosney, we'll start with you. To you, what are the greatest concerns about the issue and the refinement of healthcare reform?
There are several concerns about healthcare reform, but overall, healthcare reform is needed in how we address the physicians. How the physicians address the patients and getting patients having care. One of the things that we talked about at this meeting, or the meeting we have, is uninsured patients. There are a lot of uninsured patients. As a physician, I feel like that we do treat a lot of those uninsured patients in emergency rooms. In my places with anesthesiologists, we do operations on people who need it, whether they have care insurance or not. The individual mandate, which I think is a hot button item that healthcare reform is in the news about. People probably have opinions of individual mandates. It seems to be a linchpin of the healthcare reform. Whether Congress overreached its authority to do that or not will be determined by the Supreme Court, and hopefully it can be determined fairly soon. The Independent Payment Advisory Board is set up, I think, as a concern for physicians. To have a body of individuals who are appointed and have really no limits on their authority to be determining payment to physicians or for health care in the country. I guess one of the concerns I do have is out of the 15 people, only 5 are going to be physicians.
Yeah.
And I feel like physicians ought to lead the healthcare reform.
Dr. Delaney, what are your thoughts?
Well, I agree with Dr. Gosney. This Independent Payment Advisory Board answers to nobody. And I think what's going to happen is that's going to lead to even more rationing of care than what we're seeing currently within the United States. One of my also big concerns is how can we cover everybody without doing some form of rationing, because we can't afford to cover everybody. There's not just enough money in the pot. I think those are concerns that I have about healthcare reform.
Yeah. Dr. Hill, what are your thoughts?
Well, I think that Dr. Gosney and Dr. Delaney have covered in a more narrow way my broad concerns. My broad concern is that, number one, will we truly have coverage for everybody that's fair, which is the ultimate goal, and will it be affordable, and will it really be accessible to everyone? And the second big concern I had, they expressed also, and that's centralizing government power over medical decisions. And it's obviously in this medical legislation that whether it's planned by design or whether it's not by design, and I of course think it's by design, it will be a detriment to healthcare in this country. So those are my largest concerns, and the potential for mandates, not just the mandate we're talking about for all to be covered by 2014, but other potential mandates that could be easily teased out of that legislation is frightening. So.
Dr. Kumar?
All these concerns are very much concerns of mine, as well as my constituent family physicians, who we actually tend to manage just about every single uninsured patients that there ever is, with decreasing reimbursements. However, I think what all these individuals here are saying is that we went into medicine to help people. That's our first and foremost thing. And what we're seeing here is the politics being played in terms of providing patient care and pretty much starting to unravel the patient-physician relationship. That's a big concern of mine. Politics needs to be taken out of this whole equation here. Making public health policy based on politics will have poor downstream effects, and there's a lot of unintended consequences that can occur from that. That's one thing. Second thing is providing quality medical care with the increasing limited resources that we do have. How do we manage those resources? Who's going to manage those resources? Who's in best position to manage those resources? It really comes down to the patient and the physician.
Yeah.
You know, and I think people that are making decisions at the 30,000 foot level may not understand the decision I and my patient have to make, or I and my patient's family have to make when it comes to end-of-life care. when it comes to beginning of life care, things like that. And to me, that really worries me a lot, because I don't want necessarily someone from Washington to tell me how I should practice medicine in St. Petersburg, Florida. I need to have somebody that understands my concerns but understands the global reach of what things are happening in order to affect a proper healthcare policy. The other aspect too is that I'm concerned about, and those are the three main things. These are the three main things: is providing quality medical care. However, how do you provide quality medical care when it's becoming more of a business? That, I think, is the greatest threat towards medicine. No one can deny the advances that have happened in medicine have occurred because the business of medicine. However, the business aspects of medicine are starting to unravel the patient-physician relationship significantly. We're now more worried about paying dividends to our shareholders than we are better outcomes for patients. And to me, that's a huge travesty. There's only so many dividends you'll be able to pay out. What happens after that? Where does the money go there? So those are part of my concerns. And how much profit do you actually need? We've become so profit-driven and so less outcomes-driven. To me, that's a huge issue.
So it's trying to find the middle.
Correct.
And place more emphasis on the physician in the process.
Absolutely.
And leadership roles.
Absolutely.
Yeah. Any further comments on that?
Well,
Dr.
I believe we all know that the last 6 months of life are when we spend the most amount of money.
Yeah.
And I've always been encouraging this year, especially as I'm president of the South Carolina Medical Association, that when I speak to groups, I encourage those physicians to sit down with their patients while they're in the office before they gather around the bedside and make decisions about tubes and ventilators and those kind of things.
Yeah.
And make smart decisions so that the family doesn't come rushing in and go, oh, you have to save daddy. It doesn't matter what cost it is, mainly because I don't have to pay for it,
Right.
because the government is going to pay for it.
See, I agree with you wholeheartedly on that. However, there's limitations that tend to happen in the office setting. You only get 15 minutes to see
Right.
so many patients. Then you have EHR, in which you have to contend with. How in the world are you going to take care of all the primary care issues, plus talk about end-of-life care, plus chart everything so that your billers
Right.
and coders and get properly paid for all these kind of things within a 15-minute period?
Well, they passed legislation, I think, that encouraged you to talk about end of life and gave you a code, but then they pulled back the funding for it.
That's exactly
so no
right.
physician is going to do that for free.
That's
I
exactly
mean,
right.
because you are a business. We are small business owners.
And then on top of that, the politics come into play, where certain groups sit there and say, now you're talking about withdrawing care from people. How can you possibly do that? That is so un-American to do things like that. That's not true.
Dr. Hill. Yeah.
Well, there are ways around those problems, and I'm not a great proponent of a model of care that's centrally controlled, but I am a great component of a new model of care
Yeah.
that utilizes all the ancillary, I shouldn't say ancillary, all of the health-related professionals properly. Our nurses, our nurse practitioners, our therapists, our pharmacists, our dietitians, all those people need to be used appropriately and need to be embraced by the medical community as a real team and really work as a team. Then his 15 minutes could become 8 to 10 minutes because he's got the dietitian spending 15 minutes and the pharmacist, vitally important to me, spending a little patient education time plus going over medications with people. So this new model of care is the only way we're going to be able to handle 50 plus million more people with health care coverage if this legislation is implemented as it's proposed.
Right.
So there are ways around it, but not in the present.
So some of the
fashion.
models are good,
and
but require more involvement from the physician to make sure these plans are coordinated properly.
And they are going to require resources. They're going to require reimbursement for that pharmacist and that dietitian. And that becomes extremely important because in the long run, you're going to have fewer hospitalizations, you're going to have people not only living longer but living healthier.
Right.
And
associated.
so I think that there are ways around it, but I just worry that centralized control doesn't allow us to get around it.
Yeah.
I hope that whatever delivery model that's coming down the pie, that has a physician-led component.
Absolutely.
And I say physician-led component, not in Medicare's definition of physician, but
Right.
in the definition of an allopathic or an osteopathic physician,
Practicing physician.
who is the team leader,
Yeah.
who is a team leader.
That's exactly right.
And teams without a team leader that's a physician, I'm concerned about that. I believe that the physicians really are the quality in the team on the delivery care model. And without a physician, I think there is an issue with quality.
Well, the quality issues will basically resolve the monetary issues and the health issues.
Well, I happen to have a level 3 NCQA patient-centered medical home. Now, to be candid and honest, that's a matter of checking off boxes. Okay, but we do have more of those components. And what we've found, all of us have found, that we really are a team. It's amazing how we depend on that pharmacist for help with education, and how we depend on the nurse educator, and we've become very, very much closer.
Yeah.
And I think that's been an advantage. But we've got to be very careful how it's structured, and there's got to be a captain of the ship.
Yeah, absolutely.